Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
Today's show is brought to you by Smiles for Life Network.
Good morning and welcome to Pedo Teeth Talk from the American Academy of Pediatric Dentistry, bringing you up-to-date information and challenging ideas resolved for your practice. We're here at the annual session of the APD in Honolulu, Hawaii, sitting in the exhibit hall at the Tech Bar. And we're going to have a lot of fun today because we have a really interesting guest and a very important topic. With me is Dr. Jim Shealy. He is the Director of Doctor Recruitment and Development of the Smiles for Life Network.
Correct.
And I think your network is a form of a dental service organization,
Correct.
But they're all different. So I know this is, when I talk about the trends in dentistry, the largest things that are changing in the marketplace, and these are inexorable changes. You can't control them. They are happening. And the biggest one is what we call consolidation.
Correct.
The growth of large group practices. And I think just to hit with a starting point, if you look at pharmacy in the United States 40 years ago, you had mom and pop pharmacies. Mm-hmm. And today, if I go to Seattle or Phoenix, I'm going to look pretty far before I find a mom and pop pharmacy. It's Walgreens and Rite Aid, et cetera. Mm-hmm. Is that going to happen in dentistry?
So that is the trend. First of all, let me say that I use the term DSO expert loosely. My history is I, of course, was a resident, and then I was an associate for 2 years. Started a practice, grew it for 20 years.
You're a pediatric dentist?
Pediatric dentist, board certified,
let's make sure.
board certified pediatric dentist, correct. Grew a practice, 4 locations, several associates, et cetera, sold to a fledgling DSO. After about 3 years, I sat on the board of that DSO. We pitched it, sold it to another equity firm, and then I got out because it was not a good fit for me. It was predominantly general dentistry, and I'm a pediatric dentist. And now I have joined Smiles for Life Network.
So let me ask you, Jim, and we'll talk about Smiles for Life Networks. I know that all DSOs aren't alike, but what is a DSO? Just define DSO. What is it? And explain it to people who don't know what it is.
Right. So the purpose of me giving that introduction is that's my experience, and so that's from the place that I come. So it's interesting. You asked the question, what's a DSO? It was interesting to me to learn that DSOs have been around since 1975, right?
At least,
right?
Yeah,
Affordable care, I think, is the one they quote as kind of starting this idea. So it's not something new. I in my research and talking to people, it certainly has evolved over the years. There have been some missteps, which I think a lot of the misconceptions about the modern version of the DSO come from. But the intent of a DSO is really to provide business support for a clinician, so that a clinician
hence the name support. Dentist
correct.
Support organization, is that a better definition?
Dental support, yes.
So it's not service, it's support.
Support, excuse me.
That's the right word?
Right.
I should say dental support organization. Okay, thank you.
Right. So that it allows the practitioner to practice dentistry and not be worried about Mary at the front desk and who's collecting and who's answering the phones and are the bills is the insurance being filed correctly. It's become a little more sophisticated than that. The dental service or support organizations now, the business guys are really good at negotiating fees, which is something that we as dentists sometimes fall short on. So there's a lot of benefit to that.
Negotiating fees with whom?
Insurance companies,
okay.
Medicaid, private
So you're big
insurance.
enough, you get big enough, and you have more
Correct.
power.
Correct.
Could you call that kind of the Costco effect or the Walmart
Possibly,
effect?
yes. And I definitely saw that in my practice experience.
You have more buying power,
Correct.
so to speak.
Correct.
And that's interesting. So that's one of the things that attracted you. Is that fair to say that attracted you to the idea of a DSO?
Absolutely. Yeah. Yep.
So are all DSOs alike?
So, of course, they're not. I can certainly speak to that. I came from a small one that was kind of finding its way, and now with a larger, more mature group, and it's more organized, of course, and doing a better job, I think.
Yeah.
So they're all a little different. I think if you have a practice and you're interested in pursuing that, it's important that you investigate, right, and talk to the people that are involved and make sure that philosophically they're approaching dentistry and approaching things that feels right for you. Again, when I was with a general dental DSO, different philosophies, right? Now I feel like I've come home. In our current model, there is a pediatric dentist at every level from the board down. in the administrative on the administrative side. So we're not having conversations with the business people.
They understand how you feel.
Right. They understand how I feel.
Yes.
And also we have representation at every level, right? So every time there's a business decision being made, there's a pediatric dentist there that's making sure that their decisions don't affect quality of care. And I also, as a joke, like to say that the business people are there to make sure that the dentist doesn't buy 5 of the magic back chairs and 14 robots and 20 lasers and, those sorts of things.
You mean I shouldn't do that?
Well, I mean, they're great products, so I'm not dissing the product, but, there's a good relationship there.
I'm going to talk about your brochure here in a minute, which is great.
You like that.
And I do like it. But, if you survey dentists, and I've done this years ago and even recently, who come out of school from a long time ago today, and you say, what did I miss in dental school? What's the one thing I didn't have that I wish I had? 100% on their top list is going to be practice management. You taught me how to fix teeth. You taught me how to assess teeth, how to examine, how to look for oral cancer, but you didn't teach me how to run an office.
Right.
Is that why DSOs are here? Is an evolution of that?
Yeah, certainly an evolution of that. I will say, I've been recruiting pediatric dentists for a long time, right, for my own practice and now as a director of recruitment. I will say one thing that's worked in a DSO's favor is that a lot of kids are coming out of dental school now, we all know this, with quite a bit of debt.
Yes.
And so $250,000 to $400,000 worth of debt. And then the idea of borrowing another $500,000 or so to start a practice, and of course we want the nice car and the house. Well, that's another subject. That becomes insurmountable for a lot of people, and so that becomes not an option.
So you're saying owning a practice is not an option? Is that the issue?
Not necessarily. I mean, it still can be done.
Yeah.
But it's a harder row to hoe, as we say in Georgia. Becomes a little bit more. I mean, you start looking at a lot of dollars.
So I talk to our senior dental students, who are coming out of school, and also to residents. And so you're saying, and asking them what they're going to do. Are you seeing less of them are just saying from the outset, I'm going to go build my own office, set up my shingle?
So when I started, of course, that was an option, right? I worked for someone.
That was the
most common, right? You either were an associate or you started a practice. Now, with the evolution of the DSOs and the opportunities that we provide, there's a third option now. They can come out of school, make pretty good money, and have a nice quality of life, which is what we tell them.
Right.
And that's a very attractive, lucrative opportunity for a lot of kids.
I hear some people, more so with general dentistry than with pediatric dentistry, that they don't know how they're going to sell their practice. That's a concern of theirs because that's part of their net worth. And would you say that DSOs are that new avenue for dentists instead of selling it to another dentist? Is that sort of replaced what used to be selling it to another dentist?
It is. One more point I wanted to make about the kids coming out of school. Recently, I spoke to one of the leaders of the ADSO. Won't name him. I don't know if he wants to be associated with me or not. But anyway, and he recently spoke to the dean of one of the larger dental schools in the country, and he said that this is the first year that not one of the graduates is going out and starting their own practice. They're either going to be an associate or work for a DSO. I thought that was interesting.
It is interesting and not surprising. The figures I've heard repeatedly are that a few years from now, like 3-4 years from now, 50% of our graduates from dental school will be working for a DSO.
Sure.
At least, at some point in their career. Maybe not for their entire career.
And listen, they come out of school, we pay them well. There are, 401k options. Malpractice insurance typically is covered. It's a good way to start.
I mean, I think it's a matter of recognition of as I go back to what I said before, that the changes in the marketplace. The consolidation is one, but look at the distribution business with Shine and Patterson and everybody else running it. But now, I was living in Seattle, talking to Amazon wants to get into the distribution business. And things are getting shaken up.
Correct.
And we have to respond to change, not try to make the change, but respond to the change.
Happened in pharmacy. It's happening in veterinarian medicine. Exactly.
So I think what we tell our graduates, and tell me if I'm right, that they have more options. They still can do what they could do before. It's just the options are changing, although the marketplace is going certainly directionally towards this.
Correct.
So I'm going to talk about your brochure. You've got this little brochure I'm holding up, and it says Smiles for Life Network. It's got a picture of a of a boy about 8, 9 years old, but he's got gray hair on the side, hair on his arms, and he looks like an Italian thug. And he says, forget about it and just focus on your patients.
It's a little creepy.
Is that the theme that we should be hearing? That, for the one who comes out of school and says, I really didn't learn practice management in middle school, and I became a dentist because I want to take care of patients. So I don't want to do all that Mary at the front desk stuff.
Right, and right. So, for me, my experience was, back in the day, I didn't have the option of working for a DSO. I worked as an associate, as I said, that, ran its course, and then I decided to start my own practice because that really was the only other option, and I grew it. The problem was it got to a certain point where I have no hair, so that's obvious what happened.
I'm right there with you.
But also, who's going to buy it? A person can't buy it, or wasn't willing to assume the debt to buy it. So for me to get out of that situation, a DSO was a great option.
Mm-hmm.
And for people that are interested in transitioning their practice, it really is something that you should entertain. Even if you have a bias against this subject or what's happening, open your mind to it, because it doesn't have to be bad. Again, find someone where you feel like it's a good fit philosophically, as I've discussed, and understand that if the money is right, if it fits your retirement plans, and you really don't have a desire to check on Mary every 5 minutes at the front desk, because there's no glory in that, then this is probably a good thing for you to do.
Now, you mentioned, Jim, you said it doesn't have to be bad, which implies that there's a perception out there that
Correct.
It can be bad.
Correct.
So
it's a perception.
So what are some of those perceptions? I want to talk about what are the perceptions you've heard about DSOs?
Yeah, so the biggest thing that we hold on to as dentists, right? We're healthcare providers, and we always want the best for our patients, et cetera, et cetera. The biggest concern that we have is that someone's going to come in and immediately say, all right, I want to see you do 30 crowns today. All right, I want to see... And that just isn't happening.
Do you know somebody who can do 30 crowns in a day? I never met that person.
I'm not going to say anything.
Well, stainless steel crowns. That's different.
Yeah.
I was thinking of adult crowns.
Yeah.
Stainless steel piece of cake. Okay,
right,
got it.
Stainless steel. I'm your man.
Okay.
The point being is that, certainly in our group, the business guys stay out of the clinic. We allow our doctors to do their thing. If we were to purchase your practice and it's profitable and you're making money, we wouldn't purchase it otherwise. But and you're doing good dentistry, we leave you alone.
Wait, you're not like the show on TV. What's it called? Bar or something, where they take a bar that's not performing well and they make it into a what's it called? Bar rescue or something?
No, we haven't reached that level yet.
You're not doing that?
I will say this. When we do buy a practice, the fact that we own a lot of practices and have seen a lot of practices, sometimes we might, with the doctor, say, hey, I've seen this work in another office. What do you think about this? And that's the extent of it. But we're not going to tell you got to use this burr, you got to use this composite, we're not interested in any of that.
You do hear those things. You hear that, you hear... people coming out of, maybe they left a DSO, so
I'm hearing less.
That doesn't happen?
I'm hearing less of that.
Okay.
I think that DSOs, in a general sense, have become wiser, and it's because when these DSOs are purchased, right? If you're buying something, you want to make sure that it's quality. And so it's very interested, or the people with money are very interested that we're doing the right thing and doing right to protect their investment. So
some things, when you have systems, and that's what DSOs have, are systems, processes, which is what we all need. When you have those systems, you do eliminate choices by necessity. So, for example, you can't have 27 kinds of composite available to you.
You can.
So if you can, but is it the right thing to do? I don't know if it's right for an individual dentist to have that.
I will say in our group, what we do, and it is. We're not hounding our doctors. We're not hounding our doctors.
So if I sold my practice to your DSO,
mm-hmm.
and today I own it, tomorrow you own it,
mm-hmm.
the way I practiced for the last 10 years isn't going to change.
That's right.
Exactly the same.
Have at it.
Yeah.
Have at it.
Okay. But you bought me because I'm profitable.
Correct.
I'm at the bar rescue.
Correct. Right.
Although
exactly.
you should do some of those too, because there are economies of scale.
Yeah.
So that's what are some of the other perceptions, would you say, besides that somebody's going to tell you how to do dentistry or how much dentistry?
I just kind of think that's the biggest one.
Yeah.
Sometimes when doctors sell their practices, they think they're going to be run out on a rail automatically, and we don't do any of that either.
You mentioned before that that they've gotten wise and changed so that doesn't happen. So it's suggesting that it may have happened before, where there was a little bit of pushing people for production or... I mean, by the way, my take on the production thing is we all should push ourselves for production. We're business people. We have to produce. So there's nothing wrong with saying production as long as it's in the context of doing the right thing for the patients. So they're not inconsistent with one another all the time.
So sometimes you can hit profitability two ways, right? You can hit it with production, okay, but you also can hit it on the backside too with the economies of scale.
Correct.
So
managing expenses.
Correct. Centralization of processes from et cetera, et cetera.
A business professor told me once, cash is a fact, profit is a theory.
Right,
and I think that's true because, if you have better systems and processes, you can do the exact same thing and be more profitable.
Correct.
And, or you can be less profitable because your expenses are just out of control. So I think you've hit the subject of some of the perceptions. So are you seeing a better response in the marketplace as a result of changing perceptions and the fact that, hey, I can do dentistry and forget about it and not worry about managing the front desk and all this?
Absolutely.
You're seeing it's changing the perception already.
Right.
Yeah.
So I would encourage all of you that even are vaguely interested in this to find someone who's involved with our DSO or another one and talk to them if they've transitioned their practice and find out how it went for them. And I think the majority of the time, if they did their research beforehand and knew what to expect, they'll be pretty happy with it.
So I want to talk about some of the benefits of being in a DSO, and I think you and I talked about a few, like you mentioned the loan, the big loan debt that they have coming out, and that's one of the reasons they can't buy their own practice or they don't want to.
Residents.
Are there programs where some of that can be help pay it off with working in a DSO?
So if a DSO has practices in some underserved areas, the federal government sometimes will allow them to, through loan repayment programs, do away with some of that debt, yes.
And what about other benefits like the malpractice insurance and other...
Right, so malpractice, 401k, vacation, all of those things are negotiable contract issues, right?
Is that different in working in a small group practice?
Yes, health insurance, certainly. I mean, depending on the size of if you're going to be an associate in a private practice, sometimes those...
So you have a big group plan because you have a large organization, so everybody's part of the group plan.
Correct. And one more point I'd like to make about our situation, too. The kids that are coming out, so my situation was I get out of school, I start this practice. My plan was sell it, and that's my retirement. That was kind of the model. Now that this DSO model has come along as another option, these kids have a lot of debt. One thing that we do that would take the place of that money that they would earn if they started a practice and sold a practice is we allow doctors to purchase equity in the whole. So if you're a full-time doctor with us, every January you're allowed to purchase equity. And every time another private equity firm buys us, which that's the way this works, the money increases. And so at the end of a 20-year career, you would have basically what you might otherwise have if you had started and sold a practice, and you would still have hair. So that's kind of the idea. And for me, that would be golden. Well, the fact that,
I'm looking at the marketplace and seeing there's a growth in private equity firms and the amount of money that wants to get pumped into this. So it
dental
suggests
space is hot.
A couple of things. One is, there's a lot more growth to be had. Number one, more consolidation. Number two, there's more efficiency to be had. So it's a combination of those things.
So right now, the statistic is 15% of all practices in the U.S. are part of a DSO. So there's a lot more bandwidth there, runway there for investment. In the next 10 years, they expect it to be more than 30%. I've heard between 30 and 50% of all practices will be part of some sort of dental support organization. So there's quite a bit of...
it reminds me, Jim, when the APD meeting was in Hawaii, I think it was 10 years ago, we were here, and we had an all-day program for the foundation, and it was on different practice models and things like this, and we invited Steve Thorne, who's the president of Pacific Dental, I believe, and he got up in front of the audience. I'll never forget this. There were 500 people in the audience, and he said, if you can't do, he was talking to an audience mainly of solo practice owners, if you can't do what I can do, I can put you out of business. And he didn't say it in a way like being mean, like, I'm going to destroy you. He wasn't the Terminator. He said it in a way that our model is systems, processes. So we're seeing out there, because there are processes that DSOs have that dentists can't have because of that economy, they almost can't compete. You mentioned the purchasing and the ability to manage staff, but I'm also seeing kind of the growth of these groups that are forming on their own for that reason. So I'm seeing there are groups of pediatric dentists. Hey, let's get together, 10 of us in a large city, make our own sort of DSO. And they'll say like, well, we're not going to run it like that DSO. We're going to do it our way. But they quickly find that you kind of have to migrate towards the model the DSOs have adopted because that's what the marketplace demands. Is that a fair statement?
It is. I mean, it is.
And they're kind of like a deal. But you're seeing a lot of that, aren't you?
But dentists should be, I always say, you should be, that's kind of our home space, right? Processes. We do it, everything we do is a process. So the business side of it, it should be the same way. Should be the same way. And let me say one more thing one more point I want to make. And I'm kind of proud of this, not only from our DSO, but I'm sure there are others that do this as well. We are very careful to make sure that we have a very robust compliance process in place, chart review process in place, to make sure that we are providing quality care. It's a robust, again, for two reasons. Number one, the dentist side, we want to make sure that we're doing the right thing. And number two, of course, on the business side, they want to protect their investment, right? They don't want us to end up I'm not going to say in the news. So it's a very symbiotic now. There's a place now where the business folks and the dental folks are all kind of marching to the same beat and making sure that we are, especially in our group, I really can't speak for others, but to make sure we're providing quality care.
So I know that technically in almost every state the dentist has to be the owner, but we do describe ownership options where it's more actually, I'm going to call it actually the owner. Okay, that's my phrase.
Correct.
And how does one become an owner in a DSO in that model? What does that look like? So
that's all over the board. Okay. Some offer a percentage of the office you work in. I've heard bonus structures which allow you some ownership or some extra money that way. Our model does not necessarily provide ownership on a basic level, but again, we allow you to purchase equity in the whole, which is really, really a better situation.
Okay, I saw that your organization kind of has the East Coast, and you're kind of there, but are you kind of moving to our neck of the woods over here? Well, Hawaii is kind of far away.
I suppose hopefully. I will say this too. We want to be the largest provider of quality pediatric dental care in the country. That's our goal, right? And we're very careful to make sure that as we grow, we do it in a measured way so that we can continue that quality of care and also grow our business so that it's stable and we can support our doctors correctly. Yes, we're coming.
Okay. I got to ask you, since you mentioned quality, and I agree with you, that's the future, is quality metrics, outcomes. And I'm a big believer in big data, and I want to know, since I have the expert right here in front of me, what we need is to tap into all the data that you have, de-identify it. Mm-hmm. And we can do that with our practices too. I like to do it all together, and the truth is in the results.
Right.
And to be able to actually see, when I do this way on 20,000 cases versus 20,000 cases that were done that way, what is the outcome? Mm-hmm. Right. And big data is the future. Correct. And I think, I hope that we can talk about how we can de-identify your data, work together towards developing the quality systems, because you don't know the truth until you see the outcome.
Fair? Fair. It requires an enterprised, because this is a discussion we've had.
Yeah.
So an enterprised computer system, which we are moving towards.
You guys can do it better. DSOs can do that better than I can do it as a solo practitioner.
Because we can pull the reports, et cetera, et cetera, et cetera.
When I sorry to interrupt, Jim,
that's okay.
When people ask me about DSOs, I tell dentists, look at them, because the one thing for sure they can do better, for sure, than individual dentists is report on the quality, or hopefully not, but in some cases lack thereof, because there's so much data. They have the ability with their systems to report on how they did on the quality. It's hard for an individual dentist. They may be an outstanding dentist, But how do you report on the quality? It's very
Right.
difficult to do. So I think
Right.
that's, to me, one of the greatest assets of a DSO is the ability to report on quality.
Right.
So what do you think is the change? This is kind of my last part, and then we'll take a couple questions from the audience. What are the changes you expect, let's just say in the pediatric dental world with DSOs? What do you see on the forefront? Are things going to change the way this happens? Is it just going to be growth, or are there some new ideas coming out about how this works?
I'm sure there are new ideas. I'm pretty happy where I am right now.
Mm-hmm.
All of our offices are owned by doctors.
Okay.
So I'm the doctor owner for Iowa and Ohio. So we have offices there.
I saw Iowa, that's where I'm from.
Yeah, there you go. Yeah, Des Moines, great practices there.
Wow.
And so. I don't know. That's a broad question. I mean, things evolve, but
you can tell me next time
right.
when I ask you in a year.
There you go. Okay.
Well, I want to thank everybody for being here. We do have time for a couple questions. Are there any questions from the audience? Please come up to the microphone, and if you have somebody else line up behind, we want you to speak directly into the microphone. We can take 2 or 3 of these and just talk right into that mic, please.
My question is, what is it day one? So I own my own practice, and then I sell to DSO. Can you kind of walk me through, do you change software? Do you change employment for staff? Like, how are you like you're saying you help with...
Right. So we come in
and he has 30 seconds to answer that.
30 seconds?
Just kidding.
A whole day.
No changes. So really and truly, the short answer is we need to interface pretty quickly with your administrative staff, right?
Okay.
So you probably would notice some changes there. We would take some billing and things out of your offices, that sort of thing.
So you take the software, or you bring us software?
No, right now we don't. We don't touch your software. We don't touch your software.
But some of the DSOs might do that.
Some may.
Yeah.
Some may. We don't do that. We don't do that.
Okay.
Yet. But
how'd you get the data?
Sounds like you love your software, right?
Yeah.
Nobody loves their software.
Yeah,
I don't want to let go of it.
How do you collect the data?
There are ways we know what the dental software programs are. We can extrapolate from that, and probably it's a little more work. We can't run one report, obviously, but we still can get the data.
Okay. And what about staff?
So staffing, that's a conversation that would probably be had before you actually close or sell. We would evaluate, but usually we don't change staff. I honestly can't think of it.
But the staff will be employed by you now.
Correct.
Different benefit packages.
Absolutely.
Okay. That's part of the decision to do it. Yeah.
Okay.
Right, and usually they come out better.
Oh.
Yeah, typically.
We'll take another question. Do we have another question? Come on up to the mic, please. And we're just walking up to the mic with question number 2.
I was wondering if you could speak to the second part of the question on the topic of how can I be like...
Be like a DSO.
That's kind of what Jim Thorne said 10 years ago, right? You have to be like me.
Because I have 2 offices, potentially starting 2 more, acquiring a third over the next 6 months or so.
You're a DSO.
So that's the model that I'm moving towards, is a smaller geographic area with dentist owners of everything. How can we be more like that DSO?
Honestly, economies of scale, centralize things that if you can. Try to set up some sort of system where it's kind of plug in, right? If you added another office, it kind of plugs in. It really is, I'm going to say, not more difficult than that. We both know it is. But that really is the idea behind it. Yeah.
So how do you recommend going about that, centralizing?
Centralizing? Set up a scheduling department, where one group of ladies does all your scheduling. Set up a billing department where one group of ladies does, or men, I'm getting in trouble here, do all of the administrative work for billing. And it would help to have a good software program that can be enterprise like that. So kind of start from the beginning looking at that, because you can get yourself in a pickle if you don't have it. Yeah. Well, good luck to you.
Thank you.
Yeah.
Well, I want to thank Dr. Jim Shealy for being here today, talk to us about DSOs and what you do. And I think, as I told you at the beginning, we have some big trends in our profession, the biggest of which is consolidation. It is happening, folks, and we need to pay attention to all the trends. I always like to say that leaders don't make change, they respond to change. And we all have to recognize what's going on and respond to that, and it's always good to stay in touch with what the opportunities are. So thank you, Jim, for being here. I thank our audience for being here today, and thank you all for tuning in to Pedo Teeth Talk, where the American Academy of Pediatric Dentistry, here at our annual session and beyond, provides up-to-date information to practitioners every day. Thank you very much.
Thank you.
Today's show is brought to you by Smiles for Life Network.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry. the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.